How much cholesterol should we consume? This question is being asked many times on a daily basis. As a physician, every time we do the blood work, I have to answer this question to the patient. There is no specific recommendation that you should consume this much cholesterol on a daily basis. General guidelines are, especially from American College of Cardiology, is to keep your total dietary cholesterol intake less than 300 if you're healthy, meaning you don't have a heart attack, stroke, or you do not have diabetes. If you have any of these conditions, you should try to restrict your cholesterol to less than 200 milligram. But body is very smart. Body does not depend on how much you consume. Dietary cholesterol has a very little role in the total overall cholesterol which is circulating in your body. Cholesterol is 80% produced by your liver based on your needs. Cholesterol is a very, very important component of human life, and human life is not possible without cholesterol. All cell membranes are made up of cholesterol. Important hormones get derived from cholesterol. Vitamin D, which is responsible for your bone, is produced from cholesterol. And your digestion of food depends on bile salt, which are byproduct of cholesterol. Dietary cholesterol, how much you consume, is a less of a problem. But overall, what you consume about content of your processed carbohydrates and how much trans fats and saturated fats you consume is the real issue. Because how much body needs cholesterol does not depend on your diet, but what you eat, it bypasses the regular homeostatic pathways and mechanism and controls which are in your liver. If your diet is primarily simple carbohydrates, your level of insulin goes up. That bypasses your liver and makes it produce cholesterol. That's how all diabetics or people who have diabetes and require insulin, they have very high cholesterol. Also, diet rich in trans fats and saturated fats hack liver and make it produce more LDL cholesterol and your cholesterol goes up. When we talk about the daily allowances of cholesterol, dietary recommendations are very scarce and in actuality they don't mean anything because total cholesterol and other subfractions of the cholesterol, they do not depend on dietary cholesterol. They depend on how much your liver is producing and how your overall habits, which will hack the cholesterol mechanism. If your diet is predominantly carbohydrates and also full of saturated and trans fats, your physiology will be hijacked. If you do not exercise, your cholesterol will not be used for repair. Your cholesterol will go up. If you don't sleep well, there are hormonal changes happen that leads to increased production of granule, which decreases your good cholesterol and increases your bad cholesterol. Stress through cortisol level leads to increased production of insulin and hijacks your physiology. So combination of diet and lifestyle is more important than the dietary recommendation when it comes to how much cholesterol you should consume. I hope this video was helpful. I will see you with next video and I will answer the questions.